I have always had some problems with reflux, and it became intolerable. Then Professor Quante conducted another gastroscopy and discovered that it is a malignant tumor located at the junction from the esophagus to the stomach, confirming the presence of a cancerous growth.
The endoscopy provides doctors with important information about the tumor very quickly.
That's where we actually see the tumors for the first time. We can then take samples from the tumor in this context, and in the second step, determine the length extension. The third is, where exactly is it located? This is all of utmost therapeutic significance to know for the purpose of further planning.
The treatment plan is discussed in the tumor board at University Hospital Freiburg. Pathologists, surgeons, radiologists, oncologists, all cancer center specialists work together at Freiburg Hospital.
It begins not only with therapy, but also with diagnostics, at the initial patient presentation, in the interdisciplinary consultation. We see the patient together before discussing them in the interdisciplinary tumor board and then deciding on the treatment or diagnostic procedure.
Because the treatment of esophageal cancer is complex and diverse, and in Bettina Mackay-Smith's case, it also had to happen very quickly.
The plan for the treatment was discussed with me immediately, and the treatment started right away.
Initially with 2 cycles of chemotherapy with 4 different agents. Chemotherapy has a significant role in the treatment process, as we often administer chemotherapy prior to the surgery in order to better prepare the tumor for the operation and improve the chances of a successful outcome for the patient. This was followed by 5 weeks of radiochemotherapy, which is chemotherapy combined with radiation.
And the patients will then be irradiated for approximately 4.5 weeks with daily radiation. The objective is to decrease the size of the tumor in order to effectively minimize the small tumor extensions that might have already disseminated beyond the esophagus. In addition, we aim to sterilize the lymph nodes, which are often affected in advanced esophageal cancer, with this radiation treatment. We also use the term sterilize to eliminate the small micrometastases in the lymph nodes.
Nearly 4 months after esophageal cancer was discovered in Bettina Mackay-Smith, the operation took place.
This surgical procedure was the most challenging part of these obstacles for me. That was the tallest mountain.
With surgery, the esophageal tumor can be completely removed, a procedure lasting about 3 hours, which is performed minimally invasively to be gentle on the patients.
The tumor will be removed from the esophagus along with a large part of the esophagus and the prepared stomach in front of it. Lift, slim, and connect to remaining esophagus, so that at the end of the surgery the patient has a replacement esophagus formed through the stomach, which consequently also has a smaller stomach size. From our experience, the recovery rate and chances of recovery are extremely good. The complete removal of the tumor is almost always guaranteed, and the recovery is actually so good that we can usually discharge the patient after 10 days.
Even in older patients like Veronica Sutterlin, the esophageal tumor can be completely removed. Even if, as in her case, the side effects, such as those of chemotherapy, can be more severe.
Like a balloon losing its air. That is how I felt. And what bothered me the most was the fact that I did not have a chance to gather even a small amount of strength from time to time, which made it even more challenging for me.
Certainly we are cognizant of the fact that this condition also arises during old age. This therapy, which we are also somewhat imposing on them, is demanding and has side effects. Nevertheless, they are now seated here post a successful treatment with no tumor present.
I was additionally extremely surprised that he has gone, or at the very least is supposed to have gone, and I can confidently say without a shadow of a doubt that he has indeed gone.
The doctors are also very confident about Bettina Mackay-Smith. The multimodal therapy was very successful for the mother of 2.
The good news is that the lymph nodes we saw before no longer contain any tumor. That's actually good news for the prognosis.
To improve the chances of success, as recommended by the doctors, she will receive chemotherapy again after the surgery.
I will now overcome my final hurdle the 4 cycles of chemotherapy, and then I assume that I will remain cancer-free for the rest of my life.